Everybody.
Good morning, Vice Chair. We have, first of all, you notice on the screen this morning, the very first person in that picture there is our person. And I just wanted to take a chance to publicly acknowledge Sheena. She went through Leadership Wichita this year and graduated with the class. It was a good class, a lot of good people there. We went to the graduation, had a lot of good conversation. So just wanted to take a second and call out Sheena and congratulate her for completing what's a pretty rigorous, for those of us that have been through, it's every Friday for 8-10 weeks in a row, and it's quite a sacrifice, but it's a good connecting tool and shows that the county is part of the bigger community. So I wanted to just thank Sheena for going through that. We have 3 agenda items today to talk about. First is Dr. Craig Moreland is here to give us our annual update on Crime Prevention Fund expenditures, and then Adrian's here from the Health Department to kind of talk about the CHIP development sessions. Some of you will be going to this coming Friday, so should kind of talk about an overview of that. And then last but not least is tomorrow on the agenda is the legislative agenda. So today we'd kind of like to, Mike and I would kind of like to get that in a final form so that we could get that presented to you as a body at tomorrow's meeting. So with that, Dr. Craig, you can start us off.
Thank you. Thank you for the, good morning. Thank you for the opportunity to talk about the juvenile delinquency prevention programs. Every year we do an annual evaluation. This is the results of this year's. The programs that are included in this are supported by Sedgwick County Crime Prevention dollars, $518,866, and there's a grant that comes from the Kansas Department of Corrections for Juvenile Services for $167,000 plus. This is a breakdown that shows you the actual amounts that went to the different programs. The Sedgwick County crime prevention programs served a total, if you add that far right column up, it comes up to 900 plus individuals and 168 through the other one. So there's about 1,100 youth in this community that receive services that reduce their likelihood of delinquency. We start with, generally we look at the total condition in the Juvenile Justice Program. I wanted to particularly take note of the fact that some of the indicators that have previously been going down year after year since Senate Bill 367 was enacted, those have begun to go the other direction. The numbers of juvenile filings have rebounded. It's not a huge rebound, but it's an indicator. The juvenile correctional admissions has gone up pretty dramatically. It was 10 in state fiscal year 2018, up to 45 now. So that's an indication that some of the changes from 367 are beginning to have an impact. The new custody cases for the Department of Corrections Juvenile Services has also rebounded. At least some of that can be explained by the kids that are going to the correctional facilities and come back and are in juvenile field services for a period of time. So I think we need to look at these as somewhat early warning indicators that the efforts that have gone into play because of Senate Bill 367 are resulting in more youth in the community, ultimately more youth in the community. So every year the Team Justice, the Juvenile Corrections Advisory Board, reviews the risk factors that contribute to delinquency in Sedgwick County. They selected these as their top priorities. At least 4 of the programs serve the antisocial cognition risk factor. These 3 factors are extremely important when they're present. Fortunately, they're pretty rare. So the ones that are more common among the youth in Sedgwick County are risks that are associated with some kind of issues, either with school, family, leisure, or substance abuse. So our programs are centered principally around these. So we have 2 tiers of services for juvenile delinquency prevention. The first tier is secondary prevention, and those programs are for kids that have not yet committed a delinquent act or been caught committing a delinquent act, but are at some kind of elevated risk. The secondary programs are for kids that have already got some kind of involvement, so what we're looking for is addressing the risk factors that actually contribute to their continuing delinquency. The first of the programs is a secondary prevention program. Pando Initiative uses case management to work with middle school kids. They work at Curtis and Hamilton schools. They received almost $42,000 to serve 80 youth. They served the 80 youth, 46 of which were successful. The youth that were served were not properly assessed at the beginning of the program. I did some consulting with them to improve their assessment practices. I expect to see more out of this program in the coming year. The reason that there wasn't quite the levels of success we wanted had to do with inability to connect the right services to the right risk levels. But they've done some corrective action, and we expect to see more out of them in the coming year. The Mental Health Association is also, their PATHS program is also a secondary program. On page 10 of your report, there's the locations that they serve. I'm sorry, it's page 11, I think, 10 or 11. You can see they're in a number of schools. They distribute their services beyond the city of Wichita. They serve quite a few in USD 259, but they have some locations elsewhere. They receive $54,000, $54,300 to serve 621 youth. 537 were successful. This program is an evidence-based program. They do 8 sessions with elementary school kids. They'll do a course that has 8 sessions. They learn pro-social skills that help them to avoid delinquent behavior in the future. They needed some changes in assessment. Assessment has been something of an issue. We're trying to make sure that the services always focus on those that are most likely to benefit. So those changes have been made, and we're looking for a continued focus on evaluating the suitability of the schools. A couple of years ago, I went and did some on-site, and some of the schools had less structured classroom. It makes it very difficult for someone who's coming in to actually get the attention, hold the attention of the kids. So I suggested to them they need to be sure that we're putting the program in schools that have an appropriate setting for it. The tertiary programs, in total, between the Crime Prevention Fund and the Department of Corrections Juvenile Services, there was $590,000 applied to 344 clients. Each of these programs is serving people that, as I indicated, have already had some contact with the juvenile justice system. Detention advocacy is a combination of legal services that are available at detention hearings, and for some youth, there's an ongoing legal representation if it's not otherwise available. The case management services serve 93 youth and 75 with short-term services. They weren't able to meet their goal of the numbers served, and they also were not able to meet behavioral change goals. So the legal service will continue. The case management and short-term services are not funded this year. The Sedgwick County Crime Prevention Fund provided $25,760 to them to serve 45 youth and 31 with case management, 14 with short-term services. The same issue, this was specifically for the Hispanic youth, And these services did not meet their numbers goal, and they did not meet their behavioral goals. So they're also not funded this year. Ember Hope is an evidence-based program. Its official title is Functional Family Therapy. They received $187,952 and served 26 youth. Their goal was to serve 80. There was a change in the available population for them to serve. The state funded a program of functional family therapy in the area, and that program took a lot of the clientele that was previously served by Ember Hope. They've made some adjustments. They have been focusing around the whole question of referrals. Their outcomes are suitable. They lose clients at the second stage of this program. They're getting some extra technical assistance from the national office that consults on functional family therapy programs. Learning the Ropes is specifically to address substance abuse in juveniles. It's a challenge course. It also includes a treatment phase. They received $95,000 and served 70. 59 completed with 36 successful. They do a follow-up at 6 months, and of the ones that they followed up on, 83% were successfully abstinent. That's a really promising figure, but we would like to see a little bit higher level of response. It's hard sometimes to track down people to do follow-up, and we understand that. But 12 out of 59, basically 60 people, is a fairly low rate of recovered information. So we think that this program is having a really strong effect. It certainly gives every indication of it. It would be really good to have more follow-up information. And everyone they serve is moderate to high risk, and that's where we want it, because that's where the best return is available. McAdams Academy is the fourth year of this program. They've served students who have long-term suspensions or expulsions, and they received $114,000 and served 32 students. Behavioral progress was noted in 81 of the clients. 73% successfully completed the program. They're considered successful if they have achieved behavioral change and they stay the course essentially while they're on suspension or expulsion. So, an overview. This is about as fast as I can go and give you the information on these programs. All of the programs now have up-to-date logic models. That's important because that helps them see internally where they should be looking at points of improvement. All the programs have been trained in evidence-based practices to improve their success levels. Corrective action plans are in place for some of these programs that have not met behavioral goals. They seem to be making progress, at least some of them do. I make 2 site visits a year to each of the programs. I try really hard to make a hands-on effort to assure us that they're making the steps that will help them be the most successful with the dollars that are provided. So 1,100 clients were served, 868 were successful completers. Minority youth made up 53% of those served and had an 83% success rate. I'd be glad to answer any questions you might have.
I have a couple of questions. Thank you so much for that presentation today. This is a lot of information. Wow. So I guess I do see that you have a really high success rate of your program, but I just wonder, how long have these programs been in place, and when was the last time they were evaluated?
We started the programs that have been funded with Sedgwick County Crime Prevention roughly 20 years ago. I think it's 98 or 99. And some of these programs, Pando used to be called Communities in Schools, and they were one of those early programs. I honestly can't tell you about Higher Ground, but the whole concept and the system and continuum of programs to address kids at different risk levels with different needs has been in place since the late 90s.
I guess the reason for my question is, I'm 37 and I'm raising a 10-year-old now who lives in a completely different world than I did. And so I wonder, these programs that are 20 years old, how are we taking into account technology and how that affects behavior? It looks like you have something you'd like to say.
Well, I was just going to say, the Department of Corrections has always paid for an out-of-service provider to evaluate the crime prevention programs. So while it's not always been Dr. Craig,
but it almost always
has been, we evaluate these programs every single year.
Okay.
And over the course of years, crime prevention dollars used to be like in the millions and have decreased over time, but those programs get evaluated and they run a course of 3 years, and then we do an RFP for each one of them. With Team Justice looking at what areas at risk level are they more likely to be a problem. So they pick their target through Team Justice that we set for the crime prevention dollars. And so we're looking county-wide at what's happening.
And I would encourage you to see if Glenda can make good on what I'm going to ask you to do, but I would encourage you to take an opportunity to look at the evening reporting program as a good example. It's not one of the ones that's described here, but what you would see there is the same sort of thing. You have staff members that notice things like the changes in technology, and they're very keyed in to what the youth will respond to, how they communicate, what sorts of things do engage them. And you want to comment on that? I think she just has a terrific staff with evening reporting. I've seen the same thing with these programs, particularly in the last year or two, because what you're pointing out is very evident. The ways that people communicate are different than they used to be. Not so much FaceTime. So that makes some difference.
Well, this is a lot of information, like I said, to digest, and y'all are the professionals. I'm just here to ask questions. So I appreciate this, and I would like to kind of know a little bit more about this. So, I mean, this was a lot for me to kind of digest right now. So if you had some time, or if somebody would have some time, I'd love to kind of sit, because I do have some questions, but I don't know that we need to take it up right now. So.
Okay.
Well, I would also like to say, going back to the legal services, the detention legal services, that portion of the program, the case management, it didn't go away. We just changed the provider. It's still, the case management services is still being provided. We just moved him into the Sedgwick County Department of Corrections to provide case management for that prevention part of that program. So it really didn't go away.
Well, it went away by that provider.
Yes,
so
yes.
Thank you.
Okay. Any other questions? Okay. Thank you, Dr. Craig. Appreciate it very much.
Adrian?
Morning, Adrian.
Good morning, Commissioners. I am excited to share this information with you. Friday, and this is going to be a very high-level, brief synopsis. I'll spend about 10 minutes giving you an overview of what Victor Aqua, he is our community health analyst that is responsible for leading the community health assessment and community health improvement plan. But Friday, we're going to be rolling this out to our community partners, and we have about 50-55 that have RSVP'd so far, and I'll go in a little bit more as I go as to what we're going to be doing on Friday, but I wanted to give you an overview, kind of a sneak peek, so that you know a little bit more than anybody else about what's going on Friday. And if you're not able to come on Friday, I'd be more than happy to meet with you and go through brief what's going to happen on Friday, because it's going to be about a 4-hour process that we're going to be doing this. So local health departments do community health assessments every 3 to 5 years, and we do ours every 3 years, and it really is a systematic, very comprehensive process of data collection and analysis, and it really identifies priority health issues. We started planning for the community health assessment process last year, and then Victor and other staff, but again, he has led it, have spent the year doing the assessment and then evaluating. So you'll see that our community health assessment, we have 3 main components to it. And the first is a community needs assessment that we do in conjunction with United Way and Via Christi Ascension. We have partnered with them to do the community health assessment for, probably 12 years. And then United Way and Via Christi really take the lead with sending this out via, there's thousands that go out with snail mail, and then they send a lot out through online surveys. And if you have ever done one, there's a lot of questions on the survey. So there's a lot of information that is obtained. And then United Way analyzes the data and then send it to us. The second part of our community health assessment is the community health profile, and this is publicly available data, like from the Center for Disease Control, Kansas Bureau of Investigation, Kansas Department of Health and Environment, just a lot of data sources. And then the third component this year to this community health assessment is new. It's been done by other health departments around the country, not a lot, but less than a handful. And so what we did this year as part of our community health assessment is that we did community listening sessions. And so the community listening sessions, we focused on 10 high priority zip codes that were identified using a health risk index of having the poorest health outcomes in Sedgwick County, and focused even more on going out into the top 5. But Victor and a couple other staff went into the community, and we did about 22, 23 listening sessions out of these zip codes, and they were all asked the same 4 questions. And so what we asked everyone, and then took notes, was, what does health mean to you? Was the first question. And then, what makes it hard for you to stay healthy? What comes to mind when I say a healthy community? And we didn't define community. We left it up to them to define community, whether it was their neighborhood or Sedgwick County. And then lastly, what worries you about the health of your community? And overall, we had under 300 participants, about 270 that participated in the community. So the first 2 components of our community health assessment were very data-driven, and then the community listening sessions were more of the qualitative versus quantitative data. And when you come on Friday, and if you don't, I'll share with you what the top 5 concerns were that came out of those community listening sessions. So the process for selecting the health issues, the information from all 3 of those components, and it was probably the biggest Excel sheet you can imagine seeing in your life, were all put together. And out of that, we had 237 health measurements that we reviewed from those 3 areas, those 3 components. And health measurements being the top hospital admissions, top emergency room admissions, the uninsured rate, third grade reading level, deaths due to diabetes. I mean, just on and on and on the types of health measurements that we looked at. And then from there, we grouped them into 28 health issues because there were a lot of connections and overlapping in those health measurements. And so we grouped them into 28 health issues. Then next, we took those 28 health issues and looked at trends, seriousness as far as deaths and hospitalizations, racial county disparities of all 28 of those health issues, and narrowed them down to 16 based on the top 16 that had trends showing negative trends in those health issues, and the ones that were more connected to the potential of death or increased hospitalization. The third step is that we took all the 16 health issues that rose to the top because of the trends and the seriousness and disparities, and looked at we identified all possible other health issues that could be related to those 16 and chose the top 9 that had the most relationships. For example, mental health was one of the 16 and is in the top 9. You can see for mental health, we identified these other health issues that can contribute to can be a result of mental health. So people with mental health diagnoses oftentimes there's a high correlation between that and using tobacco. When someone is depressed, there can be higher chances for infant mortality, low birth weight, alcohol use, violence and crime. And so we went through this process with each of those 16 and then narrowed it down to the top 9 that had the most relationships, the highest amount of relationships with other potential health issues. So the third step, so we were at that 9 where we identified the 9 that were the leading drivers of poor health outcomes because of having the highest relationship of the other different types of health issues, such as we just looked at a minute ago. And at this point is when Victor went to numerous community meetings and distributed the priority survey that had the 9 issues that I'm going to show you in a minute that rose to the top. And not only that, but we also sent out a link, and I believe that I sent that link to each of you if you had an opportunity to rate how you saw those 9 as priorities. And so the survey, everybody had the opportunity to rate the 9 on importance, which is how significant is this issue in our community, and then appropriateness. Can this issue be addressed at the community at this time? Is this a good time in our community with resources to address this? And you will see, I skipped a step. Prior to that, we sent out, so in sending out this survey, and hopefully some of you being able to take the survey, we received approximately 226 back from community partners and community leaders who did rank those 9. And so then we took how, an average, how everyone rated it and ranked in order of importance from 1 to 4 and appropriateness. And then you can see the total. And there's a small variance you'll see between some of those. So the first issue that the community members prioritize was mental health. Second being healthcare access. And healthcare access can mean many things. It's not just, do I have access to medical treatment or medical care? It can be, can I afford that medical care? And even though we have community health clinics, those still aren't always affordable because they're businesses, and if you can't pay after the first or second time, they may not see them. So you can see how it was ranked in the community, and all of those issues are currently being dealt with. So these aren't new issues that we are identifying here, but the connection between the community health assessment and the community health improvement plan is that the improvement plan is a very systematic effort to address the public health issues that are identified and have been identified in that community health assessment, and then prioritizing those issues. So you'll see these 9 on Friday. What's going to happen is all the community partners that have RSVP'd are going to be there, and we're going to look at, in groups, we're going to divide people, and they'll be sitting at tables, and the partners are going to prioritize 1 to 3 of those 9 health issues that we will then be prioritizing to focus on in a collective manner in the community. And local health departments around the country choose anywhere between 1 to 5, typically, health issues to focus on. The more, of course, you focus on, the more your resources are spread thin amongst those priorities. So we're really aiming at 1 to 3 health issues to get to. And part of and Victor will be going into a lot more detail about this. Around the room will be posters that for each 9 of those health issues that will have data, and will have all of the other health issues that have a relationship with each of those. So the mental health poster will have what I showed you is one of the pieces that's going to be on that poster to help inform people as to all the connections, all the other health issues that can be a strong relationship to having mental health issues. So Friday, partners and hopefully some of you will be voting, and it's a systematic process to get everybody there. Again, this is extremely high level. But once those 1 to 3 health issues are identified, then the next part of that, before that 4.5 hour day is over, is to identify 1 to 3 goals for each one of those priority areas. What do we want to accomplish with mental health in the next 3 years? Because the Community Health Improvement Plan is a 3-year plan, so it's 2020 through 2022. And why the Community Health Improvement Plan is really important is because it holds the community accountable. We'll have SMART goals, we will have measurable goals, and we will be analyzing data from all of our partners that are working on and tracking progress on these goals. We will analyze those annually, and then be sharing what progress or not that we're making on those. The second meeting is on January 29th, and that meeting will focus primarily on, anybody is welcome to that meeting as well. That meeting will focus on those community partners that are currently working on these health issues, or see an opportunity for their organization to embrace and work on one of these issues. And then we will be taking those overarching goals and identifying specific strategies that community partners that we will all be working on, some collectively, some organizationally, to make progress on those top 1 to 3 health priorities. a lot of information, even more on Friday. Be happy to answer any questions that you might have.
Very good. I think commissioners are going to have a few questions. I will start off since I don't see anybody jumping in. First of all, if you look at our legislative agenda that I think we're going to talk about later, I'm sorry I'm a little late today, but mental health, behavioral health is what we call it, is at the top of our list. But we also put under that the drug and alcohol, and you've kind of got them broken out. So if we're going to kind of be standard with the way that the Sedgwick County Commission is moving, where we call it behavioral health, and then we put drug and alcohol, and we put homelessness in there also. And it'd be nice if we were all speaking from the same page as we move forward on this. And right now, I don't know that we're speaking from the same page.
And we can definitely lump those together. I mean, we talked about how the partners, and we can also definitely guide that, might want to, because of narrowing it down to 1 to 3, pair some of those together. And it makes sense that if you're looking at drug misuse, alcohol is another drug.
But we understand that. That's why we call it drug and alcohol abuse. We break it out in our legislative agenda. So that's the way we've been looking at it. I'm not sure what your number 2 says on healthcare access. If that is expanded Medicaid, then I don't know that you're going to have too much support from the Sedgwick County Commission for expanded Medicaid to give it to able-bodied people that can go out and work. So I don't know what your healthcare access really means.
And if you'd like more
access to a location, right?
Well, there's a lot of pieces that go into that, and I imagine for some it might be that is not what the CHA focuses on. It's access, and Victor can probably expand on this, but it's access to services, whether it's the ability to pay, because again, just because we have community clinics, not everybody can pay. Do you want to
Like she said, it's not just about Medicaid expansion. Some people don't have the ability to pay for the basic medical needs that they have. And we spoke with a lot of people that are homeless, and they have those issues because they can't even afford $20. So it's not just about Medicaid expansion, but also basic medical needs that they have no access to. And it also goes across to transportation services. There's a whole lot that goes into healthcare access. Some people can't afford to go from one referral to the other because they can't afford to drive around, or they can't afford to pay for a bus fare. So it's a whole lot of things that is lumped into healthcare access. And that's the reason why we have 28 health issues with 237 health measurements in each one. So there's so many indicators that go into one health issue.
Very good. Well, I appreciate where we're at on the community health assessment. If you recall, 3 years ago, I pushed to get the position back so that we could do this again. So I do support what you're doing. I just want to make sure that it meets the needs of the commission at the same time. Okay. Other commissioners?
Questions?
Commissioner Howe.
Yeah, thank you, Mr. Chairman. So I have a couple of questions. On slide 3, you talk about county disparity. What do you mean by county disparity?
So with data, sometimes data is too small to show to the public, because when we are looking at, for example, racial data, it might be too small because there's not so many people in each racial component. So what we always try to do is look for the best available data. So with county disparities, we are comparing Sedgwick County to those other counties that are our neighboring counties. So like Butler, Reno County, and other neighboring counties. And we also compare to counties that are of the same population size as us, because we always tend to have similar health concerns. So that comparison is just to give us an evaluation of how we rank compared to those areas.
Okay.
And the disparities can also be differences in health outcomes amongst different groups. Like infant mortality, for example, the African American community, the babies die 2.5 times more frequently than Caucasian babies. So looking at, what's going on in those groups and populations where there are those health differences. So that's part of what we dive into to then look at what kind of interventions that the community may need to be looking at to address those disparities.
Okay, thank you. On your listening sessions, you asked a lot of opinion questions. Mm-hmm. Were there also like health measurements done at some point in this process?
Well, the first two components of our community health assessment is all about data and looking at the data. And so all of that was looked at, part of what you're talking about. This is the only part that the reason I really wanted to do this is that going out in the community and listening to them tells a little bit of the story behind that data. So this is probably the most data-driven community health assessment that we have had historically. So that just that piece of believing it's important to get some community input. So that is just one of the three components here.
Let me ask my question differently. I know there's a lot of privacy concerns, with HIPAA and everything. If they can generalize, for example, the hospitals talk about cases of diabetes, for example, how many patients they treat for diabetes, or other say organ failures, like say kidney failures or things like that people needed to have dialysis. Are there doctors' offices that talk about generalizations about how many of their clients maybe have obesity issues, or how many people are actually smoking, and that they disclose how many people are actually smoking? Well, do we have those types of data?
That would be a little bit. That there would be a little bit of subjectivity to that, and so what we did was went in and looked at the data from Kansas Department of Health and Environment and CDC on exact when numbers are reported about diabetes and obesity, that we have all of that data as part of that massive spreadsheet that we looked at that tells what the percentage of adults that have diabetes in Sedgwick County, the rate of obesity in Sedgwick County. So that's all of that data was part of our process of getting to this place.
I guess I'm trying to find out, how much of this is objective versus subjective. And
the first two are all objective,
right,
or 100% objective.
There's some points, however, that there are some opinion that feeds into this at some level. It becomes a little bit more subjective, and I see that here. For example, when you say, let me give you an example here that, like on slide 7, for example, it talks about 226 people ranked the 9 health issues by importance and appropriateness, and then the community partners are going to vote on the top 3. So those conclusions are not necessarily based on data that's been collected, statistical data, but there's some opinion that potentially says we think this is the most important thing.
Well, we have to start somewhere, and instead of having us as the health department make the decision for the community, what we can tell you is that those nine priority issues are data-driven and data-supported and reinforced. And so what the community is going to do through this systematic process, because that's part of the reason it's 4 hours. There's a whole process that we're taking them through, is that they also have to look at the resources they have to address these issues. So any of those 9 could be chosen and would be valid and very data-driven and appropriate for Sedgwick County, because data shows that all 9 of those issues are health issues for our residents. So when we're getting the community partners together, this is the piece where we're saying, okay, this is what data has shown, and let's talk about what we prioritize for our community in the next 3 years.
So there are actually 3 reports that I've read just recently: the high utilizer study, the catalyst study that talks about beds availability, also what triggers those. There are a lot of reports that I'd be happy to share with you if you want to talk about data driven. This is what our mental health coalition has been talking about: mental health, access, drug use. Those are all things. How do you suggest that we collect data if going to the community is not one way to do it?
I'm not saying we shouldn't go to the community. I am saying that collecting, for example, if you went to the doctor and had a well check, they might say you are healthy or you have some health concerns because you're overweight, you're sedentary, because you have some bad habits, you smoke cigarettes, for example, or whatever it would be. Those are certainly things I would like to understand the health trends of our community and decisions that they make, and some of those things are very, very preventable. Some of the things like, for example, neighborhood quality, I don't know how we're going to impact that necessarily with health. The hospitals aren't going to be able to impact that probably. But
And we'd be glad to meet with you and go over. I mean, it's massive. All the indicators that went into the neighborhood quality, it's all data driven. And when someone goes to the doctor and if they're obese, have diabetes, they're entering that into their electronic medical record, and that's the information that KDHE gets, and then Center for Disease Control gets. That is the data that we have.
And I've looked at your, I've looked at the community health plan over the last few years, or last several of them come out, I should say. I know it's been every 3 years or so we see a new one. So I've looked at some of those things, and there's typically comments about walkability of the community, city parks, clean air, a lot of things like that. I can't think of all the things. So there's some comments about about firearms, for example, and suicide, things like that. So there's a lot of things in there. I don't know how much it will change necessarily, but I'll certainly look forward to that report. Last time you did this, I did ask for access to that spreadsheet, and you did share that with me. So I don't know if that was something that we could do again or not.
The end of the community health assessment we weren't able to be involved in, but this one we are totally involved in leading, and so we can review any of that and all of that information with you if you would like.
Yeah, it'd be nice to see like the types of questions that were asked and maybe the kind of the raw data, so to speak.
The only questions that we asked were in the community listening sessions. Everything else we've gotten, it's all data. It's all data from a number, and we can share all the resources of data. So the only subjective with hearing from the community, which again is really important, were those 4 questions and that one component. The other 2 components is strictly it's data. So there's no questions that we ask. We're going down and pooling that data.
That's good. I am just wanted to, so I understand some details here. When it talks about drug misuse, are we talking about prescription drugs or illegal drugs or all of it?
All of that. Okay. All of it.
When it talks about violence and crime, those are basically statistical data points that you're gathering?
All.
Okay. Very good. I don't know what you mean by neighborhood quality and safety, but it's interesting that actually is above tobacco and alcohol on this list.
And would you like to hear a little bit more information on that?
Sure.
Okay.
So some of the data that goes into neighborhood quality and safety are like graffiti in the neighborhoods. So with neighborhood quality and safety, we don't have so much data. So we used what we call KCTC. It's called Kansas Communities That Care. So they collect a lot of data on neighborhood quality and all of that stuff. We also used bikeability and walkability indexes, but mostly what is in there is questions like how many students mention that they feel safe in their neighborhood, and then they have a result. And they've been doing this all the way back to 2000, and we have 3 years worth of data that we've compiled. We have questions about graffiti, we have questions about safety in the neighborhood, we have questions about cleanliness of the neighborhood. So those are the kind of things that go into neighborhood quality and safety, including walkability and bikeability.
Can you talk about the scale on this chart here? There's numbers we see in the 2s to 5s.
Yes.
What's the scale?
So what we did with the priority survey was we gave them 3 options for each one of those health issues to rank them based on importance and appropriateness. So we had low, medium, and high. So with each one, the way I did it was low, medium, and high is 1, 2, 3. And with 1, 2, 3 on Excel sheet, you can run averages for everyone. So I basically entered everyone that completed a survey. If you say low, I'll put 1 in there. And then I ran the analysis for each one of those health issues by importance and appropriateness and did an average. So when you do an average, it gives you a balanced number for what everyone said.
I'm just saying I see numbers like 5.41.
Yes.
Out of, what's this, like 1 to 10?
Oh, okay. So, yes, with this, there's no scale for this. That average is just of all the 226 partners that completed our survey, we had an average of 5.41 for mental health. Of all the 226 partners that completed this survey, we had an average of 4.9 something for healthcare access. And then each one was ranked. So the highest one basically means most partners think that mental health needs to be addressed foremost.
I heard exactly what you just said. It still doesn't make sense to me.
Okay.
So we have,
I'm going to try and answer
that one might, there you go. Thank you.
I think it's a sum of the two different scores.
Yes, I was just going to say that.
And there's a 3-point scale for
Okay.
each.
Yes.
And it's a sum of those two. So it's a 0 to 6
Yes.
scale.
So I originally misspoke when I said the scale went to 4 or 5. It was a 3 scale. And so those two areas, feasibility and appropriateness, were added together to get that third column, just to give it more of a visual.
6. I apologize for that. Yes, 6.
That makes more sense. Thank you so much. I'm curious on the tobacco use. I guess I have a personal belief that smoking combustibles, and I'll include marijuana in that, smoking combustibles is bad for people's health. Tobacco, you could eat tobacco, it probably won't hurt you. Probably wouldn't taste very good, but you could eat it, and I don't think it's going to hurt you. So when you say tobacco use, are you talking about smoking or vaping? What are we talking about exactly?
It's going to be everything. Everything is in there. Everything.
All right. All right, thank you. All my questions for now.
I was just going to add, sorry, sir. I was just going to add that the reason why we went into the community to ask those questions is because we want to try to have an engaged process where we involve all the partners in the community. And also, we feel like they're in a better position to tell us what needs to be addressed moving forward, because a lot of them have years and years of experience working in mental health, working in addressing poverty, or one of those issues in there. So we felt like involving them in that process is a better way to get what the community thinks we need to address. And also, not every one of the community partners we work with are going to be at our meeting in December. So that survey was a way to capture the voices of so many people that might not necessarily be in that meeting on Friday, and make sure that we have an engaged process that involves as many community partners as possible. I don't know if that makes sense for your previous question.
Very good. I don't see any other questions, Adrian. Thank you for coming up and giving us
Thank you.
an update on this. This is an important program. We also have to bear in mind Sedgwick County Board of County Commissioners set a budget, and as we set that budget, we've set what our priorities are, and hopefully that this is something that we can use to help direct our priorities for the coming year as we go into the next budget cycle.
Thank you.
Thank you.
Okay, with that, we're ready to talk about legislative platform now, and I think, Mike, have we handed these out to all of them?
No, we are doing it now.
Okay, so it's a two-pager basically coming at you. Mike has rearranged to some degree priority issues, kind of talked about the joint partner statement, and then we have other issues of importance. And if you could envision this as the front side of a card and the back side of a card, I think that's kind of what we're working towards. So we'll talk through today what the content of this is. Our hope would be to structure it and have you vote on it tomorrow. And then that gives Tony a couple weeks to craft the card and the actual product that we would then begin to market. So Mike will lead this. Jason's in the back. And I think we ought to try to get as close as we can to a finished product today, if that time will allow.
Yeah, thank you, Tom. Mike Papoon, County Councilor. As Tom just mentioned, the last week we've been trying to look at the format of this and hone some of the issues. And again, invited Jason. You're welcome to come up here. Mr. Watkins is here and I discussed several of these items yesterday with him, including the format. And as the manager said, what I've tried to do with the handout today is to give you an idea of what some kind of a palm card or something could look like. I know the chairman has indicated several times it's real nice to be able to just hand out something. And Tony, I'm sure, can with his magic, come up with something that looks pretty impressive to include maybe something that looks like the first page on one side of the palm card, our priority issues, and our joint statement, and then the other issues of importance on the back, which we can narrow down or include. And so that's what we did. In talking with the manager yesterday, we felt that maybe bring up the other behavioral health, mental health issues into the priority issues, because it looked a little odd in the previous draft of platform I had. I think under the joint partner statement, I have language that says in other organizations promoting the interests of South Central Kansas. I don't know if we want to include a specific organization or to delete that information and just leave it to City of Wichita and the Regional Chamber. And then under the other issues of importance, we've added, I think one since last time came to my attention, that Commissioner Cruz has raised an issue, which I'll get to in a minute. But the first issue has to do with, the first three issues are community corrections issues that have been raised by Glenda Martins. The domestic violence issue is an issue we're still looking at. This was brought to our attention by Senator Faust-Scudeau, that there may be a bill that modifies in some fashion domestic violence statutes. The privacy consideration matter, we're looking at amending the Open Records Act to protect detention deputies and former law enforcement officers from having their home addresses released. Talked to the sheriff yesterday, and that's also on the Kansas Sheriff's Association platform. I know Commissioner Howell has mentioned the motor vehicle laws allowing citizens who have paid their fines or child support to get their driver's license reinstated. We have a task force right now looking at that issue, and we could still leave language on the back of the platform under these issues that could support legislation that might come out of that task force. And I know our District Attorney, Mark Bennett, is very involved in that matter. Number 7 has to do with the scrap metal database. I know the City of Wichita in their draft platform includes, at least right now, language that involves scrap metal data. I don't think it's being promoted by the Sheriff's Association or the District Attorneys at this time. And then number 8 is, and we don't have to have these in any particular order of importance, 8 is a statement on expanded gaming and the fact that if expanded gaming does happen during this legislative session, that we get some of the revenues. And 9 is the issue I was discussing a minute ago that was brought to our attention by Commissioner Cruz, and it has to do with a potential bill being introduced by Representative Elizabeth Bishop that deals with probably a state loan repayment program similar to what was done in Texas. And I know Mr. Kaufman might be able to talk about this a little bit. It was in one of our very first drafts of the platform, but it would allow people with specific degrees in loan debt to come work for Sedgwick County, work with the underserved, underprivileged, and hopefully have some of their loan debt forgiven. So looks like you have a question, Commissioner Cruz.
No, I just have an overall statement.
Okay.
Are you ready for it?
I'm ready for it.
So to me, like this is a huge. I mean, coming from a graphic design world, Tony, this is a lot to put on one little piece of paper. Second of all, I think, when we talk about our strategic plan, what is our mission? What is our vision? We're the Board of Public Health. We are public safety focused. To me, it seems like as a priority for a commission, we would want to then lay this out as a priority for things that we want to accomplish. Does it fit behavior, or does it fit public health? Right? Where does that fall? Behavioral health, mental health, addiction services, those kinds of things. Public safety. what fits under that. Are you guys following me here? And maybe it's too late in the game to think like that, but I think when it comes to, I mean, it seems like if we were to adopt number 9, that would go with behavioral health, because that's getting people to stay here to work for us. That goes in line with all other behavioral health initiatives. So does, honestly, the domestic violence thing. You know, if we look at it like this, I mean, even number 8 could be as well. So I think that we probably need to like put some. And Jason, how do you feel about that when you're talking to legislators about what's the priority for the Sedgwick County Commission? If behavioral health is our number one thing, what are the things that we want to accomplish? To me, it seems like an organizational type thing, that this is just kind of all over the board. But good job.
Thank you, Commissioner. I think it could work either way. Different organizations do it differently. I think that the counselor's attempt at the organization on this was to kind of say, here's the top priorities that we're going to go try to address, and that Sedgwick County is going to have to take some significant leadership on, meaning me and my team within my firm. Then the other issues, which are issues of importance, are issues that Sedgwick County, it's important to Sedgwick County, they're issues that Sedgwick County supports, and that I think maybe other groups are going to take significant leadership on, but here's things that we support. They're more seen as policy statements. I think you could certainly do, as you suggest, the Wichita Chamber, for example, does exactly what you're describing. I think they have a 2-sided postcard, and theirs are organized by topic. So, they'll have a statement that says, addressing critical issues with behavioral health are important, and then they'll list, 2 or 3 things that relate to behavioral health that are critical to the chamber or that they want to see the legislature address. Same thing with economic development. They'll make a statement about economic development, and here's 2 or 3 things that the chamber thinks the legislature needs to do on economic development. So you could certainly organize it that way. What's more effective? I think we spend a lot of time and give a lot of thought to graphic design and how this stuff's organized. At the end of the day, what's going to get the attention from the legislature is the stuff that you tell me you really want the legislature to pay attention to, the stuff that you're communicating with legislators about is what they're going to focus on the most. So probably answered more than what you asked for, but.
I might also mention that, and as Tom mentioned, we're hoping to have something adopted tomorrow. If we can come to essentially a consensus on the language we want in our platform, I think we can work with Tony and come up with a card that captures the essence of this without capturing every word of our platform, but it will capture what our priorities are and fit.
Tanya has, this is an example of our 2018 platform, and here's last year's where we had a front and back card. I'll just pass them down to refresh your memories on that. I agree with Mike. If we could at least focus on content right now and how we structure this. I will tell you, Commissioner Cruz, that strategic plan's coming before you tomorrow too. There is consistent language in what we're proposing as a legislative platform along with our strategic agenda. It's just a question of how we now package that together to satisfy you all. I think we have some ideas on maybe how to do that. So.
And I think with the issues of importance, that helps give Jason guidance. If a bill comes up during the session dealing with scrap metal or comes up regarding suspended driver's license, and we have a statement on it, that will allow Jason on his own, without having to come to the commission, try to get a consensus, to lobby in favor of that or in opposition to it, depending on the statements that we have in our platform too.
I agree that once we know the issues we want to push, then we can figure out what the format is in order to be able to present those. Because I think the first 4 ought to really have a heading that talks about behavioral health, so that they know that that's behavioral health is at the top of our list. But that's how we design it. On the back page, one other thing I think we need to say somehow is that we support other organizations, and we will, as different issues come up, we'll throw our backing behind those other organizations. Because things like the item 6, the motor vehicle laws, item 7 with the scrap metal, and we're missing one, I think, that we ought to be supporting, and that's the dark store theory. Somehow, if we don't need these 6, 7, or the dark store theory in here, I don't think, if we say somehow that we're going to support other organizations in their efforts to support things that are important to Sedgwick County. And I don't know how to say that really gracefully right now, but to keep this so that we can get it on a palm card, and to make sure that we're supporting the chamber, we're supporting KAC, we're supporting the city of Wichita. We just need a broad statement that says, hey, these other organizations also have priority issues, and many times they fall in line with our issues, and we will go online and support those issues.
Well, I can obviously modify the joint partner statement, but it kind of captures that, Chairman, and talking about supporting the initiatives of our key partners. And again, it is no trouble at all. If we see a bill come up in the session, Jason will let us know about it. We're going to track the bills on a daily basis. At the weekly meeting, we can certainly bring those bills to your attention and get a consensus of the commission on how to address those bills as well. I just don't know how a general statement other than what we got is going to give Jason very much on the spot direction to lobby.
Again, I don't think we need to list everything. Jason, we talk to him all the time. We tell him the dark store theory is important to us. I don't know that we need it in here. We talk to Jason all the time, and the driver's license issue that's being worked with a task force right now. If it comes up, and say, hey, Sedgwick County supports that. The scrap metal, if that comes up, then we can say that we support it. But it's not something that we need to clutter up our issues with. And just adding the dark store that I talked about, that's just one of a whole litany of different things that could come up that we can't foresee at this point in time. We need to make sure that we're flexible enough that we can throw our weight behind specific issues as they come before the legislature.
Well, thank you, Chairman. When I first became a commissioner, I think our legislative platform the first year I was here was like, I'm going to guess 7 or 8 pages long. It was, as a former legislator, being on the other side of this, I can tell you that when the lobbyist from Sedgwick County came and visited me as a state representative, they said, here's our platform. They didn't really go through it with me, and it sat on my desk and eventually went to the trash can pretty quickly because I get enormous amounts of paper, and you can imagine. Trying to keep this as short as possible is I think is the most effective way to actually communicate and hopefully get the folks up in Topeka to remember the top 1 or 2 or 3 priorities of Sedgwick County. If you give them a long document, it'll become less effective. So a year or 2 after I got here, we kind of changed the way we did this. We put our priorities in the shortest format possible on a very small piece of paper, and we had, if you will, a back document. And a back document wasn't really intended to hand out to people. It was intended for our lobbyists to understand our positions. If he had the question, he could go back and reflect on that and say, we've debated that, we approved that, and it gives him clarity as to where we really are on these issues. And so having it as a back document, I don't mind it, for us to debate that and to agree in an open meeting and vote on those back statements. I do have a problem with making an overarching statement of support to any other organization because they do things we may not agree with. They do some things we probably do agree with. It depends on the topic. The Sheriff's Association has in the past taken some issues that I very much disagreed with. And some of these other organizations, like REAP, for example, they have some issues on their platform that I don't think we as a commission agree with. And even the Wichita Chamber, as much as I love them, they have at least one statement I think that we as a commission have in the past not agreed with. So the reality is, I think to lend broad support, in my opinion, is not clear. It's certainly not succinct. If they add something to their platform that we don't agree with, we're not being clear as to what things we support, what we don't. This is our platform. We can put things on the backside that we agree with and be very clear. I don't mind a general statement of support to other organizations as long as we maybe identify North Junction, whatever it would be. Some of those things ought to be named as things we support. I think obviously mental health. I think we all agree on mental health somewhat that we ought to see some type of solution to that.
I was just saying that I think that's a good point because KAC supports Medicaid expansion.
Right.
So.
Again, for me, that creates conflict between the organizations. That there's some things we don't necessarily agree with. And by the way, the KAC, as much as I think they're a great organization, they also have a very long platform. And my opinion is, and I talked to their leadership years ago, and they agreed with me at the top that their platform is not as effective as it could be. They should follow our advice and do what we've been doing, but they continue to have these very long platforms, and I don't think they're very effective. I would also point out we've been very effective. We've passed a lot of issues in the last few years. Jason, you've done a tremendous job. The reason we've passed a lot of issues is we've identified things that don't necessarily, they're not necessarily huge, expensive issues, but they're problems in the law, like our Senate Bill 130, for example. That was a tremendous issue, and I'm very proud of Sedgwick County for identifying that and passing that. I noticed the first 4 items on this list are going to require a lot of money. And because of that, I don't think it's likely, not to be a pessimist, I don't think it's as likely they're going to pass because it will require budget support from Topeka, and I just think that it's more difficult to pass those things. The last two are much easier. I would expect items 5 and 6 have a much better chance of passing the session. So I'll predict my prediction is 5 and 6 may pass, first 4 may not pass. I'll also point out I think number 2 on the front is a duplicate, in my opinion, to number 8 on the back sheet. Number 8. And if I was going to keep number 8, I don't think we need number 8, but if we were going to keep it, first of all, there's an extra word in the third line there. It says such gaming should be distributed to the Sedgwick County. I don't think the word the needs to be in that sentence. So please delete the word the. I would actually support this more if you change the entire statement. Let me read how it should read, in my opinion. If the state supports legislation expanding gaming, such gaming should be used should be used to address behavioral health needs in our region. In other words, I don't know that I necessarily want the hospital, whatever the solution is, to be a county-run hospital. I think it should be a state hospital. If they want to place it in Sedgwick County or place it just outside our border, to me, it's not really, the location is not as important to me, as long as we have something in our region that the state would put some money into. And to me, I think that whether that money comes from gaming or any other source, I don't care where it comes from. So if they expand gaming, I think it's the point of the statement. I think wherever they place that money, it should be for mental health, ideally in our region. And I think that's a better statement. So I think number 8 could use some help. I would support the dark store statement if that was on here, but it's not that I can see. I think the Cora statement on number 5 is a can of worms. I don't think the state. I think it's very unlikely the legislature will open that up, but I don't mind it. I don't mind it on here. I don't think it's likely to have number 5 on the backside. I don't just like the driver's license thing. I don't think it's likely that they'll take that up. I don't mind it. I don't mind it being on here, but I don't expect that to necessarily be something that passes. And by the way, I'd like to thank Commissioner Cruz for your respect last week on leaving the number 6 on there and having that to discussion. I would say I wasn't pleased with the conversation about I just need to stop regarding my talking to legislators. As a former legislator, I was curious to find out if they were aware of the 75,000 suspended licenses in Sedgwick County that we have over half the state's issue. And I think that's very curious to me. I was wondering if they were aware of that, and they have some concern. I was actually asking them questions as well. We don't have a policy statement for Sedgwick County. I don't have a solution I'm pushing forward. I do support the Sheriff's Association or the DA's Association that's going to, the task force that's discussing it. That's a fine way to address this, but I do think it still belongs on our back sheet because it is a big problem for Sedgwick County. And I think it's one of those things that's likely to pass. We'll pass something this session, I would think, on that issue. And on number 6, the issue of the motor vehicles, I would just simply say we have to make a decision whether we want to have corrections or punishment. Because as it sits right now, it's punishment. Once someone becomes a good player, they've paid their fines and done their job. If they can't get to work to earn the money to pay their child support or pay their fines, it doesn't even make sense to me. So as our law currently sits, it's punishment, not corrections. And I just simply say, I just think it's a mistake of our state. We just need to address it. And so I think it does belong on our platform. That, again, I'm not saying we should lead on this. Let the task force lead. But in terms of clarity, let's leave it on the sheet. I'll stop talking. Thank you.
I just want to add one thing. I really don't want dark store theory to be on here because I think it's going to suck all the air out of the room like the daylight savings time. I mean, I think that there is like a mystery about it that I think, I don't know, that's just my own 2 cents about that.
Okay. It's on KAC's agenda too, correct?
Say that again? It's
on
KAC's agenda. Yes. But that's what I'm saying. I don't know that I need to include dark store theory, but there are some things that other people are pushing that we can tell our lobbyists that we support. And that's why I think that some of these things don't need to be on there. And I use dark stores as an example to explain why I didn't think that the stuff on the driver's license or the scrap metal need to be on this agenda.
If I clarify well, Commissioner Howlett, I think your rewording of number 8 is worth looking at in a more simpler format. I think from my perspective, the real emphasis that we've discovered is that if something happens, we want to make sure that the share of revenue that's distributed goes to something specific in the law so it avoids the 8 million sweep that's gone on. I can see why maybe there wasn't enough services to get 7 million from casino money a year to support. Nobody was using it. In this case, mental health, we'll use it. It'll be used. So that's really more of the emphasis is if they're going to do it, let's make sure that money goes towards mental health or our services or whatever we're calling it, behavioral health services. That's and how we reword it. It is fine with me. I don't know about the rest of you.
I guess I need to have a clarification there. I mean, what I've tried to do is basically say that if they expand gaming, that a portion of that comes to us for behavioral health needs. Are you trying to say, Commissioner Howell, that all of it should go to behavioral health? We're trying to tell the state that?
The state has a need to address behavioral health across the state, especially in Sedgwick County area,
right.
Our region. So if they expand gaming and there's a new revenue available to the state legislators, right. I want that money poured by them into our region to address this problem. If they give us the money and we are in charge, first of all, I don't think they'll ever do that. But there's a difference between a state-run hospital and a county-run mental health hospital. I'm okay with either idea. I'm just trying to think what's going to pass. And so if I tell them, when you get your hands on some new money, we want you to address mental health in our region, to me, that's what the statement should say.
So you're suggesting that the state takes its money from gaming and put it in our region?
I want them to address mental health across the state, but especially in our region. Yes.
It's been my experience in watching the legislature that once they get their hands on our money, we won't see it again. But, I mean, we're welcome to do it. I mean, if a portion of that money is directed to Sedgwick County, then we might be able to do something with it. But we've seen what happens with the legislature.
They haven't passed the law yet, but right now they're taking in 22% of revenues from the casinos, 2% for problem gaming, which they sweep, as you've already said, Commissioner Meitzner. The 20% goes to general fund, and they just use it however they want. So if there's expanded gaming and they get something like 22% or whatever the number would be, they haven't passed the law yet. When that revenue gets in their hands, and it's in their hands by nature of the passing the law, when they expand gaming, they're going to have their hands on money. I'm asking them to invest that money in our region or across the state, but especially in our region, to address mental health needs. It's an area that desperately needs to be funded by them, and they don't have money in their existing budget as they get access to new money they can direct that money towards mental health.
I guess the question is the money or a portion of the money.
Yeah, I mean,
So-
that's
and
one of
and
the.
I kind of follow what you're saying.
Yeah,
Jim. I don't
frankly,
know how do you feel about that, Jason? Would that put it? They're aware that mental health is an issue in the state right now. I think that's being elevated.
And before Jason talks, what I was thinking when I did this is something similar to the Sedgwick County getting 1% of the casino revenue. And that's our money, and we can do with whatever we want. It's going to the general fund. And I was thinking that maybe we could earmark that if we got it. But I'm concerned that if we don't get the money in some fashion like that. And most of the gaming bills I've seen over the last 20 years or so always have some percentage earmarked for cities and counties, like Mulvane and Sedgwick County. If we don't get that in the bill.
and I agree. I think the fight, again, following the casino split on the how they split those funds up, 5% goes to local governments. And I would assume we would get a percentage or 1 or 2% of that revenue for our use. And hopefully we would also put the money into mental health. I would like to encourage us to consider that as a pre-planned way to spend that money when it comes up. But to the extent that they're going to have their hands on 22% or something like that of the money, what do they do with that 22%? I don't want them, just putting it anywhere. I'd rather see that money dedicated towards mental health. It's probably the state's biggest priority, not just our biggest priority. It's the state's biggest priority. So I think I would my opinion is all of the money from expanded gaming could go towards mental health, and they could spend it all and probably even more.
Well, since this is going to be addressed tomorrow and hopefully in some kind of final fashion, maybe I can get together with you and Commissioner Meissner today, and we can craft some language that'll be acceptable to the board.
Okay.
So.
Any other comments? All right. Thank you, Mike. Do you have anything else, Jason?
I would just, if I could, Mr. Chairman, I understand the conversation and debate about the specific language on where the revenues would go from expanded gaming. I would give the commission a little bit of encouragement to not think that they have to be overly or terribly specific on that language. I think you can kind of make a statement about the importance and what you would like to see. You can leave yourself some flexibility then if it does get expanded for us to then inject ourselves in those negotiations as they go along and maybe then target money where you want it to go. So you don't have to solve the whole issue with the statement. You can be a little more generic, a little more vanilla, and it probably benefits you in the long run to do so.
That's helpful. Thank you.
Very good. Thank you. Anything else, Mike?
No, sir.
Okay.
Just for clarity then, on the second page, you want those all to stick as written, like items 4, 5, 6, 7, and 9, or you want those to stick as written on this agenda? So 4 is DV, which is could be a sheriff's issue or law enforcement issue. 5 is a sheriff's issue. 6 is being carried in the DA's office. 7 is on the city's platform specifically, and 9, I could argue almost as a workforce, almost a chamber issue, but the chamber's platform is done. So do you want these to stick as written? Is that the consensus on as we create our card?
It may be a consensus. It's not my preference.
Okay.
I would be in favor of less is more, but I think determining what we kick off and what we keep might be a challenge.
Let me say once again, the back sheet, in my opinion, is not for transmitting to legislators. It's for us to agree for a moment in time that when these issues come up, our lobbyist has clarity as to what we support as a majority of this commission. If there's a majority on each one of these, then they should stay on here. I don't support some of these things on here either, but if there's a majority that supports each one of these individually, then I think they should stay on. But what I think the Palm card should have our leading priorities, maybe the top 6 or the top 3 or whatever it would be. The back sheet really is more for Jason and just for us to agree in a point of time that these are priorities by the majority of the commission.
If I could jump in, talking with Jason, we may want to look at a palm card or something that just has our priorities on them. We can put on our website, we can put our entire platform on the website so that anybody that's interested from the community can see what some of the other issues are, but not try to get all of that on one card. And back to what you were saying earlier, Commissioner Howell, I mean, you know, we used to have lengthy platforms similar to the KAC, where we'd have a lot of statements such as we'd oppose unfunded mandates, we support home rule, you know, a lot of those kind of generic statements. And we could still do something like that with the idea that that would just be something that we have, not for legislators, but have on our website just to have some legislative positions that the county might be in favor of, which could include dark store theory and a lot of other things too. But just when we get to actually handing something out to legislators, focus only on the priority issues that we want to have. Just a suggestion.
I think we need to focus on our priorities, and the rest of them, as I said several times today, we can support as the individual bills come up.
That's what we had, sir.
Okay. All right. Commissioners, what do you all have today? I have one thing for the commissioners. Tomorrow, looking at the agenda, it doesn't look very long, but as I look at each item, I think it's going to be long. In addition, we've got at least an hour executive session. So my question is, would you like to have Lisa and Carol cater in lunch for us at a certain point tomorrow?
Yes.
You don't think it's necessary for lunch?
Okay. Either way.
I can skip a meal.
I don't eat lunch.
You think it's necessary?
I don't care either way.
I don't care either way.
I don't care. Either way.
I don't care.
All right. Lisa and Carol, you got an easy tomorrow. We're going to starve.
They don't make us get the meeting. That's right.
I don't believe that in a heartbeat. I hope, hopefully. All right. Electeds. Kelly.
Remind that this week we have 2 high school choirs coming in to sing. If you have time, tomorrow afternoon, we have Clearwater. And then Thursday, we have Mulvane. And then we'll be down in the lobby downstairs.
Can we bring Clearwater over to where we're meeting and maybe it'll speed things up? Good. All right. Staff, anything? All right. Go to work. Thank you all.
Thanks, everybody.